Hi everybody, welcome again to Dr. Manny's YouTube Learnshops. This is part 1 with techniques for managing data for data analysis in qualitative research. Okay, the learning objectives for this session are, I would like to review what qualitative research is again, and then look at the specific techniques for qualitative data analysis. And we'll review conceptualization, coding and categorizing as a component of document analysis. We'll again review conceptualization, coding and categorizing as an element of examining data relationships. We'll analyze, report, present qualitative data in the context of displaying data, and we'll look at validating qualitative data in the context of authenticating your conclusions. And then we'll look at your role as the researcher in the research process, which I consider being reflexivity. However, you require further reading in relation to any of these topics, you can do so. This is just broad. Okay, what then is qualitative research, which we've covered previously, but we'll look at it in a different context. Qualitative research involves collecting and analysing non-numerical data. This is not quantitative, it's qualitative, in order to understand concepts, which are views, beliefs, opinions, experiences from participants. It can also be used to gather in-depth insights into a problem or generate new ideas for future research. Qualitative research is the opposite of quantitative research, which involves collecting and analysing numerical data for statistical analysis. Qualitative research is about people. Quantitative research is about numbers. From my perspective, qualitative research is commonly used in the humanities and social sciences such as anthropology, sociology, education, and any of the health sciences, which includes nursing, which we've covered before. What are some of the fundamental elements that we'll revisit briefly of qualitative research? The purpose is to describe a situation, gain insight into a particular practice, to format with no predetermined categories. Sampling is typically purposive. Data is often in-depth, explanatory from a small sample. Analysis identifies themes or patterns from concepts and perceptions of your participants, and the findings essentially illustrate explanations and individual responses. What are important concepts related to qualitative research? Well, typically, it's in the natural setting, free of any controls, unlike quantitative research. It's holistic. We try and consider all the contextual factors. Then, humans are really the research instrument. Remember, you as a researcher are involved in the whole research process, so you're essentially an instrument. Then consider the emergent design. And this is as insights are gained throughout the data collection and analysis, there's emergence or progression or evolution of the data that you're collecting. Then you've got data saturation or redundancy, which essentially is the stage at where you as the researcher consider that collecting any additional data doesn't add any new information, which you've got to make transparently clear in your documentation. What are some of the research designs which we've covered previously? The 4 most common ones are ethnography, phenomenology, grounded theory, and case study evaluations. So what then is qualitative data? This is data that's not reduced to numbers. It's data that's related to concepts, opinions, values, behaviours in a social context. The transcripts can be of individual interviews or from focus groups. Also from field notes, which you document through observation, documents, audio and visual or video recordings. What are some of the types of qualitative data? Well, you've got the structured texts such as literature, stories, survey comments, news articles, or even books. You've got the unstructured text, which is transcription from interviews or focus group interviews or conversations that you have. Then you've got audio recordings, which could be anything that you record digitally. It could encompass music as well. You've got video recordings, which could be graphics, pictures, or again, visuals. So let's move on. What then is qualitative data analysis? Well, this is a non-statistical range of processes and procedures following data collection. So once you've collected your data, analysis occurs. However, typically in qualitative research, they occur concurrently. And this is based on an interpretive philosophy which examines human behaviour, meaningful human behaviour, and symbolic content through words and gestures. Symbolism is basically what we say or communicate, whether it's physically or communicatively in words. The key activities involved in this process are observation, where you identify patterns. You're going to have explanations, descriptions, and interpretation of those patterns, descriptions, which are present, and they're in your conclusion. I think it's important that we just briefly look at some of the analytic terms which are not exhaustive, and you can look for further terms if you choose to. So, what are concepts? Concepts are constructs, ideas, perceptions or thoughts, and they're agreed on. So they're agreed on meanings to terms, and they don't exist actually in the real world. So therefore they can't be measured directly, but can measure things our concepts summarise. So for example, I've just chosen feminism, but it could be a concept related to nursing, such as caring. But look at this, the abstract concept of feminism. It doesn't actually exist in the real world. But if someone promotes a behaviour that relates to female equality with men, they talk about it constantly, then one can construct a measurement for feminism. If you looked at an abstract concept such as caring, which also doesn't exist in the real world, I mean, how do you measure caring? But if someone like a nurse promotes a behaviour of caring within their vocation, then you can construct a measurement for caring. They're abstract concepts which are important as a qualitative analytic term. Here are some other terms. Themes. And themes are items of the participants' accounts when illustrating their perceptions, their experiences, that the researcher, you, consider relevant to the research question. So themes may be expressed in the form of phrases or sentences. This evolves into coding. Coding is how you as the researcher define, organise the data being analysed by examining relationships between the codes. And codes then are the concepts that you give a name to or a label that describes what's being said and tends to be shorter and more succinct as an analytic unit. Then we group. Categories are collections of similar data sorted and arranged to identify and describe characteristics. And these categories are created by chunking, which means putting together, groups of collected data. We'll look at these as we go through in a little bit more detail. Let's look at two broad terms of data analysis. You've got deductive analysis, which utilises a structure or a predetermined framework to analyse data. So it's out there in the literature already. And this uses studies that are useful where researchers are already aware of probable responses from participants. So for example, if you had researchers looking at a healthcare system, a study that explored patients' reasons for complaining about their healthcare system, the interview may explore common reasons for patient complaints, such as waiting times for treatment, extended waiting times for treatment, expense of treatment, treatment unavailability because it's in a clinic in a village, out in the middle of the jungle. The data would then consist of examining each interview to determine how many patients had complaints of each type and the extent to which the complaints of each type concur. However, while this approach is relatively quick and easy, it's inflexible and it can potentially bias the whole analysis process as the coding framework has already been decided in advance, which can severely limit themes, codes, categories, theory development. Then you've got inductive analysis. And this involves analysing data with little or no predetermined theory, structure or framework. It's new. It's unique. And it uses the actual data from the current research to derive the structure of analysis. However, it's comprehensive, which is good, but that makes it time consuming. However, it's the most suitable where little or nothing is known about the study phenomenon. And this is the most common approach that's used in qualitative research to analyse data. Inductive approaches to analyse qualitative data includes thematic analysis, which we're going to cover in the next section. And thematic analysis is probably the most common method of data analysis used in qualitative research. It's looking at themes. And this method arose primarily out of grounded theory, but it can be employed in other research methodologies such as ethnography and phenomenology. When it comes to data analysis, in the traditional methods, it's a lot of work. They're labour intensive. However, after collecting the data, typically you transcribe the source material onto a word processor. You make multiple copies, Xerox them, photocopy. You have to meticulously read the data and conscientiously assign codes to the themes. Then you organise the codes manually, a lot of work, to analyse patterns that you've identified. What are some of the analytic principles that relate to qualitative data analysis? Well, you've got to remember, people are all different and they have different experiences and comprehension about their reality. So just because you say something like, I don't know, Pain. Everybody experiences pain differently, and their comprehension of their pain reality will probably be different. It's a social phenomenon that can only be understood in the terms of its own context, and it can be used to describe a phenomenon or generate a theory grounded in the actual data. And it promotes an understanding of human behaviour, which may provide insights to a problem or insights for future research. What are some of the features of qualitative analysis in relation to data? Well, it's circular. It doesn't have a linear process. It's not linear. You can go back and forth, which is referred to as being iterative. And as a consequence of that, you progress with your analysis. It also means that the researcher is intimate with the data. You become very, very close to it because you're constantly reviewing it. Data collection and analysis are concurrent. They typically occur at exactly the same time. So as soon as you start collecting data, you start analysing it, which again in quantitative research isn't done. In quantitative research, you collect the data, and once you've collected the data collection is concluded, then you start analysing the data. In qualitative data analysis, it's typically concurrent. As soon as you start collecting the data, you start analysing it. So data has got meaning, which means, for example, caring. I mean, if you collect an apple, it's an apple. So therefore, in qualitative data analysis, you can have numerous types of methods. Okay, when it comes to data analysis, there are certain strategies that you employ as the researcher. And as I've mentioned previously, over and over again, the researcher becomes immersed in the data. You really do know your data because you're involved with it all the time. You perform informal analysis, as I said at the beginning, during the interview, data collection. You transcribe immediately after the interview. You can be transcribing during the interview. You can be transcribing just before the interview. And you make analytic memos for yourself to review during the interview and during the transcription. In the margins, you can be making notes. And in doing so, you identify themes and codes, and you allocate themes and codes into categories. And eventually, you develop a conceptual framework that explains your findings clearly. What are some of the challenges, though, that you have during data analysis? Well, as we've mentioned previously, you've got lots of data. It's labour intensive, and you have to make sense of all this data. And one of your objectives is to reduce the volume of data, your information, however, not information that's important to your study. Redundant data. And having said that, you keep a record of that redundant data because you want to mention that in your research project, which adds to the validity of the research that you've done. The challenge that you've got is you've got to identify themes, codes, patterns. And then you've got to define those codes and those categories. And then you have to present the data whilst constantly being reflexive, meaning that you think about the data constantly. Because being reflexive adds to validity, and we'll be reviewing reflexivity further on in this session. And then you've got to make conclusions about your findings. How do you manage qualitative data? Well, before the data can be analysed, you've got to format it somehow to allow the analysis to occur. And as I've mentioned, this can be overwhelming because you've got a lot of data. However, you can record the text, you can have field notes, you can have memos. Look, you can record it audio, or you can take video recordings. You will make detailed lists of the demographic data, including interview dates, times, transcription dates and times, and you create a filing system. You can even use qualitative data management software, which we'll review briefly here, but talk about in the subsequent presentation. So what's document analysis? Well, when you're analysing documents, there are basically 4 steps. You've got raw data management, where you've got a lot of data coming in and you need to clean it, which means get rid of some of it, because some of it will not be relevant. But keep it, don't throw it away. Then you've got data reduction, which is a form of cleaning, is where you start coding. If you've got information that doesn't fit into codes, chunking just means putting into groups. Then you've got data interpretation, which involves coding and clustering those codes into categories or subcategories. And then data representation means telling your story. And this is where you make sense of all the data that you've collected. This is the data analysis spiral, which was adapted from Creswell, 2009. And basically what it means is you've got raw data management, data cleaning. This is where you organise raw data, or this is sometimes referred to even as open coding. All terms that you need to become familiar with if they're important to your research project. And when you organise the data, you're reading it. Not once, not twice, not 3 times, but constantly. Immersing yourself in the data, and you're constantly making notes. And this is where you identify themes from perceptions, attitudes, behaviours. And as a consequence of that, you're reducing the data by putting the raw data into codes and developing themes. And you're constantly interpreting the data, making sense of the data, telling the story about your research. And as we said, it's circular, it's constant, it's ongoing, it's not linear. So let's look at step 1. Step 1 basically is managing your raw data. The data that you've just collected. And this is the process of preparing and organising data, which is just all over the place, into meaningful units of analysis. And as we said, this could be text or this could be audio recorded data. However, ultimately you form quotes or transcripts. And as you review your data, you find some of it isn't usable. Well, that just means it's not relevant to your study. But keep it just in case. And document that you've kept it and where you've kept it. Then you've got step 2, which is data reduction. And this is where you as the researcher get a sense of the data holistically. You read it over and over and over and over again. This is called immersion, where you as the researcher and the analyst immerse yourself in the data. And this is where you start to begin to classify and categorize, allowing for deeper immersion into your data. And you're writing notes. We'll call it memoing. You're writing memos to yourself so that you become more familiar with your data and maybe revisit certain concepts down the track. And this is the preliminary classification of schemes or themes or categories that emerge, and this is where raw data is put into groups, which we call chunking, and categories. Then you've got data interpretation. And this is where you examine and you sort and organize your data further. And you develop an initial sense of what's usable, and you put them into general categories. This is where preliminary sets of codes are developed, clustering of raw data into units that are similar, or you think have got similar meanings or qualities. And this creates an initial, because you're by no means anywhere near finished, an initial coding list, a list of codes. This creates categories, and categories basically are the building blocks of qualitative data analysis. And this is the point or theme of interest for you as the researcher. But remember, categories have got subcategories. For example, if I had the category nursing qualities of nurses, then I could have subcategories which mean caring. You're holistic. You're a teacher. You're a patient advocate. What happens during the coding process is basically that initial coding divides data into meaningful analytical units for you. And as we've said, then we start to reduce the codes, maybe once, twice, 3 times. You constantly reduce them because you can have codes, 700 codes, which creates categories, 30 categories, too many. So you reduce again and again and refine the codes that are mutually exclusive and include all the raw data that you identified as the analyst as being usable. And it could be just a word or a single sentence or a paragraph. What are certain coding levels? Well, you've got plenty. It depends on the research approach that you're taking. But they can be descriptive to interpretive to the coding pattern. And that moves from summary to meaning to explanation. You can have open coding, axial coding, selective coding. They all mean different things, but they're sort of similar. And this moves from the initial theory to developing relationships between codes for category development and your emerging theory. You've got a first cycle, second cycle, third cycle, fourth cycle, possibly in the coding process. And this is where you move from describing the data units to suggesting what they mean. In open coding, for example, you've got codes and concepts. In axial coding, you can have subcategories and categories. In selective coding, you end up with a core category, which is typically what you have in grounded theory. But take a look at the process. The process isn't linear, it's cyclic. It's non-linear. I think it's important to include this section as well. What are some of the types of codes? Well, you've got what is called an a priori code. As you get into your research study, you'll learn more about this. And a priori codes are inductive codes that are derived from previous literature, research, and theoretical frames, the theory. And this involves researcher intuition about the data or setting. And it's developed before the data collection commences, before the current data is collected. You know something about the research that you want to do. Essentially, that's what it is. And sometimes in qualitative research, this is a form of bias, especially in grounded theory. Then you've got in vivo coding. And typically this can be inductive, grounded, or discovered. And this is suspended in ideas about the research topic and lets the data determine the codes, which means it's new. The codes are derived from the data by using code names drawn from the actual participant quotes or interpretation of the data. So for example, if the research participant constantly uses the term nursing care, then this can become a category that's based on the phrase that was used by the participant, which makes it unique. In vivo codes are grounded from the data. It's new. So when we look at our final step, step 4, data representation, well, this is the interpretation or analysis of the qualitative data, which I said occurs simultaneously with your collection. And researchers interpret the data as they read and reread and reread and reread again the data, and then categorize and code the data inductively through thematic analysis, which is the most common form of analysis in qualitative research. And the themes then become the story or the narrative. And what does that mean? It basically means telling the story with the data. And it's about storytelling, which is narrative. It can be chronological. You can have reflection, where you flash back. It can be involving critical incidents, theatre, themes, visual representations, which could include figures, tables, and charts. So, what are some of the expert academic analytic approaches? Well, I've just included some here. I'm not going to go through them in any great detail, other than just for completeness that they've been included. You can have domain analysis, grounded theory, thematic analysis, ethnographic analysis. You can have linguistic or metaphor analysis, cultural analysis, phenomenological analysis. You can have autobiographical analysis, narrative analysis, case study, focus groups, mixed methods. It's your choice as the researcher which methodology you choose to employ for your research study and the approach to analysis. So, in summary, it's important to prepare and organise your data, and this can be in the form of printout transcripts, gathering notes, documents, or any other materials, and it's important to always mark the source of reference. To review and explore the data, which will require you as the researcher to read and reread your data, to get a sense of what it contains. And it's important you may want to keep notes about your thoughts ideas and any questions that you have. Memoing. It's important to create initial codes, which you can use highlighters for, notes in the margins of your reflexic journal or diary, sticky pads, concept maps called diagramming, or anything else that helps you to connect with your data. You review codes and revise or combine into categories, and you identify recurring themes, language, opinions, beliefs, and then you present the codes in an organized manner. Okay, how do you validate qualitative data? Because it's not about numbers. It's not about statistical tools. So let's first look at what is validation in research. Well, two common terms are reliability and validity. And these are concepts used to evaluate quality of research, typically quantitative, not qualitative. And they indicate how well a methodology, technique, or test measures, evaluates, or appraises something. Reliability is about consistency of the measurement. And validity is about the accuracy of that measurement, the evaluation, and the appraisal. And look, it is important to consider reliability and validity when creating your research design, planning your methods, and writing up your results, especially in quantitative research. And it's interesting that a lot of qualitative researchers go against the belief that reliability and validity aren't relevant to qualitative research, because it's just terminology. So consider that as well. So what do we do when we validate qualitative data? Well, as I said, unlike quantitative researchers who apply statistical methods to establish validity and reliability of their findings, we don't. Qualitative researchers aim to design and incorporate strategies to ensure trustworthiness, rigor of their findings. So validity in qualitative research is about trustworthiness or rigor. And this refers to a study, the degree of confidence in the data, interpretation, methods used to ensure quality of the study. And some words or terms are typically credibility, transferability, dependability, and confirmability. However, believe me, there are many, many others. It depends on the research approach that you take. So have a look at this slide. It puts most of it together. So when it comes to rigor in qualitative research, credibility relates to internal validity, which is used in quantitative research. Transferability relates to external validity, which relates to quantitative research. Dependability is reliability, and it's confirmability, not conformability, which relates to objectivity. So when we look at credibility, it's talking about the truth value. When we look at transferability, it relates to how applicable is it to your research. When we look at dependability, this is consistency. And when we look at confirmability, it relates to neutrality. So what are the solutions in these? Well, in credibility, it's about prolonged or persistent observation, triangulation, peer debriefing, member checks, and just in case there are deviant cases, to analyse those as well, which means they could be redundant in relation to your research. And that's what I said. Anything that doesn't relate to your research and you've taken out of your analysis, keep it. Because by being transparent and talking about it, when you talk about your findings, then this relates to credibility of your research, which means you've done the right thing. You're being transparent. When it comes to transferability, we talk about thick descriptions, referential adequacy, preventing premature closure of the data, and using a reflexive journal, which means we're talking about getting a lot of data, stopping data collection only when you've got data saturation, and being reflexive about your data. Dependability is basically about auditing, and it's auditing of the whole research process, your methodology, which could include a reflexive journal, because you've included it as part of your data collection and as a tool in data triangulation. Confirmability is also related to your reflexive journal. You as a researcher are not neutral. Qualitative researchers are part of the research process. You're a data collection tool. You're a tool. So when we look at the individual components, what's research credibility? Well, credibility of the study refers to the extent to which a research account is believable and appropriate, which means, do academics believe what you've done? And was it appropriate what you did? With particular reference to the level of agreement between the participants and the researcher. So remember, it's your participants' data that you want, not yours. But you can be part of the process because you are. As a tool, you're analysing. But it's important to make sure that what you've analysed and interpreted is what the participants actually said. And this is the truth value, or the confidence in the truth of the study and the findings, which are the most important focus as the criterion. Then you've got research transferability. And this is the degree to which the results in a qualitative study can be transferred to other contexts or settings with other participants. In quantitative research, the term is generally generalizability. However, this is analogous with the term transferability in qualitative research. So you consider now, since the findings of a qualitative project are small in number, a lot of academics believe it's impossible to demonstrate that the findings are applicable to other situations or populations. Personally, I disagree. However, this is something for you to reflect on, because you may probably say, well, when you do your research project, which you'll probably be doing in this course, it's impossible to generalize my findings because it's a qualitative project. However, consider, from my perspective, that if you're doing research in nursing and you've, for example, done research in a geriatric population, why aren't the findings possibly generalizable to a critical care population? After all, we're all nurses. We're all in the nursing profession. You consider. Then you've got research dependability. And dependability is important to trustworthiness of the data, because it establishes that the research study findings are consistent and repeatable. For qualitative research to be dependable, the processes within the study should be reported in detail. That's your methodology. And by reporting it in detail, this enables future researchers to repeat your work. They may not necessarily gain the same result, but it provides them with a framework that can follow what you've done as far as the research process goes. And in doing so, your research design may be viewed as a prototype model that other researchers can follow. As I said, it doesn't necessarily mean that they're looking for the same result. They may find something completely different depending on their sample and the setting. But the research process is dependable because you've structured it a framework that future researchers can repeat. Then you've got confirmability, and that's the last criterion of trustworthiness that you've got to establish as a qualitative researcher. And this is the level of confidence in your research findings that are based on the quotations, the narratives, the words, the transcripts from your participants, rather than your biases as a researcher. And confirmability establishes that the data and the interpretations of the findings are clearly derived from the data and able to be confirmed by other researchers. Rigor, validity. So, what are some validation strategies? Well, remember, you're the policeman, you're the detective. And this can be involved in extensive field work with low inference descriptors and using triangulation, different forms of data collection which provides different forms of analysis. And this is where careful consideration of potential cause and effect and systematically eliminating rival explanations, codes, themes, irrelevant data until a final case is made. This is where data collected is over a period of time and you get direct quotations of participant accounts and always cross-checking information from your participants and making conclusions in relation to procedures or sources that you've used. Other strategies include participant feedback, cross-checking, peer review, other academic input, external audits, and most importantly, reflexivity. And this is where feedback and discussions about your interpretations and conclusions are involving the participants, cross-checking. Discussion with peers, academics, who are familiar or unfamiliar with the research, which helps provide member checks. Using outside experts to assess the quality of the study. And self-awareness and critical reflection by you as the researcher on potential biases that you might have introduced and your predispositions. A priori analysis. So in summary, it's imperative that all qualitative researchers incorporate validity strategies to enhance the trustworthiness of a study and its implementation. And remember, there are no universally accepted terminology, it's pretty broad, or criteria used to evaluate qualitative research. However, during this session, I've briefly outlined some of the strategies that can enhance rigor and trustworthiness of your qualitative study findings. So let's, as a final component, review reflexivity. Now, reflexivity involves reflection, but it's not the same thing. So let's review reflection first. Reflection is a meta, or a lot of thinking processes. And it involves thinking about our thinking, basically. And this is a form of analysis with a focus on you, how you think, your thinking behavior and your actions. And this is reflecting on a process that could involve consideration about what happened, why, how you felt about, or how you impacted on it, or how you may respond in the future. The frontal components, however, are describing the event, situation, process, or concept. It's about interpreting, or analysing, reviewing, or thinking about the outcome and how you as the researcher may change in the future. It's interesting. I mean, look at Einstein there. I really like this quote that he had. He said, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. Reflection is part of the process. Okay, reflexivity. Well, what is it then? This is a process of reflecting on yourself as a researcher. But you can use reflexivity in any situation, any context. But as a researcher, this will give more effective and impartial analysis. You don't want to introduce bias. And this involves examining and consciously acknowledging the assumptions and preconceptions that you bring to a research, a study, and therefore you could shape the outcome, which is not what you want. None of us are detached. None of us are neutral. None of us are objective observers, as is purported in quantitative research. How can you be neutral as a researcher? We're all human beings who hold opinions and pre-formulated ideas based on our experiences and what we've been exposed to in our lives, our lived experiences. It's about our understanding of the world, our reality, how we see the world, what's real to us. This is your ontology. Become familiar with it. You're going to need it in the future. And ontology is based on our own patterns of how we think, our behaviours, our personal values, our politics, culture, ethnicity, religion, age, gender, and occupation. It's our reality. It's how we see the world and how we perceive it. So what's an example of reflexivity? Well, in research, for example, it could involve an emotive topic. It could be something really emotional, such as talking about people who have experienced death of a loved one. And it is emotional. If you haven't experienced it, one day you will. And if you're the researcher, you may project your own feelings into the interview because you've experienced it. And it has how you would feel or they would feel if they were in the same situation. It's the researcher's reaction to the participant's answers that may influence what questions the researcher asks and how they ask them. And this can influence the participants, respondents, subjects' answers. If you're a researcher reflecting, it's important to use a tool called bracketing. And this is important because if you bracket, you'll recognize these things and ensure that your biases aren't introduced when you're conducting the interviews for your research project. Bracketing is not about you. It's about you not introducing what you believe into the research process. When you are now interviewing or collecting data, and most importantly, when you're analysing the data. It's not about you, it's about your participants. What are some of the types of reflexivity? Well, you've got prospective reflexivity, which refers to the effects of the researcher on the study, because you can have an influence on the study and you don't want to have an influence on the study. Then you've got retrospective reflexivity, and this refers to the effects of the study on the researcher, because the study can have an effect on you, and in your research you can actually introduce a component which, for example, it says researcher reflections and reflexivity on the study. Well, you can talk about how you have experienced it as a lived experience, whatever the topic is, but you make it very, very clear that these are your reflections. And this adds to the transparency of the research process, because you're acknowledging possibly that you could have introduced bias, even though you used the bracketing tool to negate or eliminate any of your preconceptions about the study topic. What are the aims of reflexivity? Well, in qualitative research, it's important because there are many ways, as we said, that you as a researcher could bias the study. And this is from the data collection tools, collecting the data, analysing, and then reporting the data. Reflexivity ensures credibility of your studying findings by reducing the possibility of researcher bias because of the subjective nature of qualitative data. And it helps you as the researcher become aware of how the values, opinions, experiences of the participants have been brought to the research, and this can be a positive thing, and how the research process has affected you as the researcher. What's a practice that is related to reflexivity? Well, practicing reflexivity in research, you can keep a reflective journal, or you can call it a reflexive journal or diary. Terminology. You can maintain open dialogue and discussion with your colleagues, getting feedback from your colleagues, as we mentioned before, which adds to validity and reliability of your research. You can internally reflect on the research process and how you've gone about it. So in summary, reflexivity is an important tool in qualitative research because there are many ways you as the researcher can bias your study. From the creating of the data gathering tools to collecting the data, analysing it and reporting it. Understanding these effects can be an important part of the research process, and ultimately reflexivity is about being transparent, letting the reader or the person evaluating be aware of what you're doing. And it's a subtle readjustment of you as the researcher, your self-awareness, that can have a profound difference to the outcome of your research study. So in conclusion, for this session, analysis of qualitative data is dependent on you as the researcher, your analytic and integrative skills, and your personal knowledge of the topic or the social context where the data is collected. It's the emphasis in qualitative analysis, which is sense-making or understanding a phenomenon. It's not about predicting or explaining. It's a mindset which is creative and investigative, and it's needed for qualitative analysis because it's based on ethically enlightenment and a set of analytic strategies. Sure, as you'll see, there are software programs that can be used to automate coding processes in qualitative research methods. However, if the coding plan is biased or incorrect, the resulting analysis of the entire study can be biased or flawed. Remember, software programs cannot decipher the meanings behind the words or phrases or the context within which these words or phrases are used, which may lead to significant misinterpretation of the qualitative analysis. From my perspective, I don't use software programs. I do it manually, as is recommended by many of the academics in qualitative research. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.